Now, a controversial new telephone advice line manned by qualified doctors is set to provide an alternative to the very high cost of visiting a doctor. The service, which is free for all HSF health plan subscribers, has been welcomed by those struggling with everyday medical bills. But would you trust a diagnosis over the phone? Joining us this morning to discuss this is Dr. Jim O'Donnell and mother of three, Sharon O'Reilly. Put my teeth in them all over the shop. Jim, good morning to you. Sharon, very welcome.
Morning.
Jim, I'm going to come to you first, and let's talk about the plan and what it offers. Essentially, it's offering a doctor at the end of the line free of charge, because some of the research that was done suggests that 55% of Irish people don't go for routine medical checks like going to the doctor because of the cost. That's huge. That's 1 in 2 of us.
I think this is 24/7, every day of the year, available service. So it is there, it's free. And I suppose we're used to, in England, this provision on a free basis. And we're also used to GP appointments and hospital attendance is free. So it's not such a big thing for us. We just regard it as part of the normal service we would provide. But you can see that if people had to pay for a service, that it would make it difficult for some. Also, I think geography makes it difficult, and then convenience. It's a very convenient thing to have a GP at the end of the line at any time of day or night. And I think patients like that.
And one of the other interesting things was, which I think just sells it instantly, is that 80% of those who called in the pilot scheme, the research from the pilot scheme that you ran here, didn't then need to do any follow-up stuff. That it's more for maybe reassurance and somebody saying, no, that's grand, don't worry about that, you're okay there.
Yeah, I think, and in many cases, people are just looking for advice, reassurance, a second opinion. They may want advice on medications they're already on. They may want advice on questions that they didn't think of when they were speaking with their GP. And they might have had an operation. Not everything might have been explained to them. Or if it was, they mightn't remember it. So there's lots of reasons why they will want advice. Sometimes it is about a diagnosis. They've got symptoms, they're worried about them. They're not sure should they go to see a GP. So they are looking for advice as to from a qualified GP. Do you think I need to take this further? Do you think I can treat myself? Or what do you think it might be? So
you wouldn't really see it, Jim, as a tool for diagnosis per se?
And it's a lot more than that. It's an advisory service right across the board. Sometimes it is for diagnosis. And
can you make an accurate diagnosis over the phone without seeing someone in front of you? You're a doctor, you've been doing this for a long time. Would you happily put your hand on your heart and say yes?
Not 100% of the time, but about 80%, 85% of the time, the evidence shows, I mean, we've been doing it in the UK for the last 25 years, and the evidence shows that you can be accurate in your diagnosis from the history alone in about 80 to 85% of cases. In the other 15%, the history will also tell you that you need further examination. You need some tests, possibly. It might give you the diagnosis, it might be very obvious, or it might give you a short list. It's either this or this or this, and you can explain that to the patient. Sometimes you might be very sure, well, this is self-limiting. It's going to go away without any treatment. And again, you can reassure the patient, and you can give the patient a timeline. You can say, this is going to last for another 2 weeks or 3 weeks, but then it'll gradually go away.
The things it can't be used for, it can't be treated as an emergency service, and it can't be used to deal with pregnancy matters.
Correct. And it's not, you can't prescribe and you can't refer.
Okay.
So if
so you can't use it to get a prescription. You've still got to go to your doctor to get a prescription.
Absolutely, yeah. And a sick note.
And a sick note.
So all of those things you'd still need to go to your own GP for.
And we've been saying it's free all morning, but you do need to subscribe. You have to be a part of the HSF plan.
Yeah,
it's not free to viewers at home watching today.
No. Okay. I think you've got to be a HSF contributor.
Yeah.
And then once you are, you have free access to it. So it doesn't cost you to make a call.
Okay.
So you can call any time of day or night. You can make any number of calls, and the calls can be as long as you want.
Okay, well, we have here a HSF subscriber. Sharon, good morning to you, Sharon. One of the things I saw in the research that was a lot of it was mums calling by kids.
Yeah.
You're a mum, you've got 3 kids, and one of your children was quite sick.
Yes, my eldest boy had congenital heart disease when he was born almost 8 years ago, but he's doing fine now.
We're glad to hear that.
Yeah.
We're glad to hear that. And you obviously, now you racked up a lot of costs.
Yes.
Visiting the hospital, the car parking, all the rest of it. It's a very costly business.
Very costly.
And you were part of the HSF
That's
plan.
right, yeah.
And you got some money back as a result.
Get money back, yes. I'm a member this past 9 years now, and it really helps with the day-to-day costs. the HSF offer a very efficient and prompt service.
Now, you haven't actually used the helpline yet.
I haven't used the phone line yet.
But do you like the idea? If you're a mum, there's lots of mums watching this morning with kids. If you were worried about one of your children, seriously worried, would you take them to the hospital and emergency room, or would you pick up the phone? What would you do?
Well, you know your own child best, and you know if it's an emergency, you'll head straight for A&E. But 99% of the time, the child may just show symptoms of maybe chest infection. And in my case, my children have always got sick during the night when it
when the doctors aren't there.
You know, when the doctors are not there. So it's great reassurance to have.
Just to know it's there even.
A lifeline until you get to your GP, and I wouldn't hesitate to use it.
Sharon, do you mind if I ask you, how much do you pay for your plan, your family?
I pay €7.50 per week.
Per week.
And this covers my husband and my 3 children.
And you get all sorts of benefits as well. You get legal advice, you get a counselling service. I mean, it does seem like a great scheme.
Yes, that's just new to the scheme as well. But I've received a maternity grant. You get payment for alternative treatments, doctor, dentist. So it's really, you know, a lot of people don't know anything about the scheme, and it's really good.
And what do you think about the controversy about people saying, sure, you can't diagnose something over the phone, you need to go and see a doctor? I mean, you've had a very, very ill child who is now thankfully better, and we're glad of that. What would you say to parents who might be concerned about picking up the phone? Well,
I say always pick up the phone. With the HSF plan, it's 24/7. You may not always be able to get to the doctor. Like myself, I work full time, so you know, surgery only, I suppose, 4:30 would be the last surgery appointment. And if your child is ill after those times, it's great to have the reassurance of the line there to pick up the phone and speak to a qualified doctor, and they'll advise what to do.
Definite thumbs up from you, Sharon.
Yeah, definitely.
Well, we're very glad to hear that everyone's well in your family.
Yes,
Sharon, thank you very much for coming in this morning and chatting to us. And Jim, thank you to you as well. You're actually practicing in the UK, Jim?
Yes, in Berkshire.
And just very quickly, how have doctors here felt about this being rolled out? Have they welcomed it with open arms and said...
Well, I think many doctors realise it's complementary to their service. It's not, by no means is it a replacement. And it adds extra capacity, so it makes access to medical opinion easier. And also maybe it sifts out some of the people they don't need to see.
Yeah. Because, let's be honest, there's a lot of people who go to doctors when they don't really need to be going to the doctors, and they just need someone to say, you're grand, don't worry about it, everything's fine.
Exactly.
Good idea. OK, Jim and Sharon, thank you both very much.